Hello everyone, this is Sharmia. In this video, we are going to see what is meant by health screening services. First of all, in this, what are the contents we are going to see means introduction, scope and importance of various health screening services, early detection, and referral for undiagnosed cases. First of all, introduction. Health screening services are medical tests that doctors, pharmacists, or healthcare professionals use to check the diseases and health condition before they are any signs and symptoms. Screening helps find problems early on when they are easy to treat. Health screening services means this is done by a doctor or pharmacist or healthcare professional. This is used to check the disease, which are the disease has no symptoms or the symptoms is showing, delayed symptoms is showing means only we have uh, we will have health, which are the disease which is not showing any symptoms or which will show delay symptoms. In this condition we can take health screening like bp checking, glucose checking, cholesterol checking, like that. Screening will help us to find the disease early. By finding the disease early we can treat the disease condition early. Health screening help you find out if you have a particular condition, even if you feel perfectly well without any symptoms or signs means also. If there is no symptoms or signs of any disease, even though but you will have any diseases underlying which do not show any symptoms, it can be easily detected by health screening. Early detection followed by treatment and good control of the condition can result in better outcomes and lower the risk of serious complications. The early detection of the disease will promote the early treatment and good control of the condition also good, and serious complications will be lowered. The risk of serious by finding the disease early, we start the treatment early so that the risk of further complications will be prevented. What is included in the health screening? What are the health screening are done? In general, a basic health screening involves in most adults is depending upon the age. Doctors will recommend the screening test. Regular that include BMI. BMI is used to check the obesity of the patient. Obesity is the major reason for the underlying diseases like heart attack, MI. If the obesity is due to the fat buildup, means cholesterol will get high and it will lead to further complications. So BMI has to be checked. Skin check is also necessary. Cholesterol is the major. Cholesterol and BP rising are the major risk factor for the heart diseases. So that by checking this we can easily early detect the disease earlier. Blood sugar level, yes, blood sugar level is also is can cause underlying conditions like kidney problems, ocular problem, nerve damage, etc. So that by finding detecting diabetic earlier, by starting the treatment we can avoid the further risk. Eye exam, lung function test, if there is any underlying condition we can check. Bone density check, immunization and screening for sexually transmitted diseases. Next one is scope and importance of various health screening services. Screening help us live longer and healthier lives. Screening essentially help in identifying diseases in people who do not yet have any symptoms or signs of it. Yes, if there is no signs or symptoms, means also we can easily detect whether there is any diseases underlying by using the health screening methods. Mass screening for certain common diseases is often recommended and can be cost effective. Yes, some screening methods are mostly cost effective only. The goal of such screening is to improve the health. The major goal of this health screening is to improve the outcome. An example in early detection of high blood pressure is detected in a health screening, so that we can also reduce the underlying symptoms. Next one is such detection can help prevent stroke, a heart disease, by timely start of medication and counseling for lifestyle changes such as losing weight, giving up smoking, cutting down on salt, and regular exercises. Yes, by early detecting the diseases, we can not only the treatment drugs, we can also um, adjust the we can also reduce the disease by adjusting the lifestyle changes, such as losing weight, as well. Weight is the major risk factor for several diseases. Smoking also, if we left smoking means our blood pressure will come normal within the 24 hours. Cutting down on salt is also can lead to various kidney problems like that. We can also avoid salt, and regular exercise is also necessary. In the near further, screening will become even more important. In fact, some companies are already offering their services by doing a genetic profile of the person and providing some them risk profile of potential diseases that they may be prone to. Yes, health screening, for the health screening, some companies also are offering health screening services, which will be helpful for the patients and peoples who are suffering from various diseases. There are several scope of the health screening services. A person who has a knowledge of health screening can work in a hospital. He can work in he can also work in the hospital or community pharmacy. He can also run a own laboratory. Many of the companies are providing now providing a door-to-door health screening services. He can also join in these companies. Then, in pandemic conditions also, he can give this services. What are the importance of various health screening services means? It will help us to identify the early detection of the diseases. It also reduces the mortality rate. Severity of the diseases is reduced, and effectiveness of the treatment is increased. Anxiety will get relief from patients who have thoughts of that they have more diseases. Their anxiety will get released. Then helps avoid unnecessary precautions will get avoided. Allow focus on crucial area, catches the signs before complications, ensure early intervention and less invasive treatment, help you to take preventive care. These are the main various importance of the health screening. Health screening standards include six main criteria as follows. Proper use and maintenance of the equipment is necessary. Receiving adequate training and improving the competence of personnel involved in the screening process. Documented procedures for recording the results. Safety includes issues regarding body fluids handling, explanation of the results, monitoring of the screening outcomes, and referral process. There are several types of health screening. First one, BP. BP is used to do to used to find out the hypertension. Measurement, how we can measure the BP means a person is considered as hypertensive when their diastolic pressure is more than 90 mmHg and their systolic pressure is more than 140 mmHg. If there is poor control in their BP, then their damaged cardiac, cerebrovascular, renal and ocular may cause death. Next advantages means new hypertension. By checking the BP, new hypertension cases, if there is any new hypertension cases means it can be detected. It also helps us to monitor the BP and to observe the usefulness of the medications. Patients to improve medication adherence behavior can prevent hypertensive consequences and minimize the workload of the general practitioner. How we can check the BP means first we have to make the patient comfortable, ask them to sit in a chair for 5 minutes, relax. Next we should give pillow adjustment in their back and we should make the patient to relax. Next we should ask the patient to take his arm straight in a brachial artery. There will be a brachial artery in the right arm. He has to make the arm straight to the heart. Next we have to release the pressure in the cuff and put the cuff tightly around the arm. Next the wire must come along the brachial artery. Then we should place the stethoscope head in the brachial artery and give pressure, increase the mercury level more than 200, then slowly release the pressure. The pulse sound is get started. It is starting sound is systolic and the ending sound is diastolic pressure. Normal blood pressure systolic is less than 120 and diastolic is less than 80. Elevated means 120 to 129 systolic and less than 80 80 to 80 to 89 is no 80 to 89 is elevated. Stage 1 140 to 159 is systolic, 90 to 99 diastolic. Stage 2 is more than 160 systolic, more than 100 diastolic. Next one is blood glucose level monitoring. Blood glucose for glucose level monitoring. Glucose diabetic is also a major risk factor for renal, ocular and other diseases, so that diabetic control is also necessary. For blood glucose measurement within the pharmacy can provide valuable information, identify the individuals with abnormal blood glucose level. It helps the individuals with diabetes and unable to perform his or her own blood glucose level monitoring. Blood glucose measurement in community pharmacies should not be used to initiate or alter the treatment. Pharmacists may send a written report through the patient to the physician for further follow-up only. In consultation with the prescriber only, the pharmacist can counsel the patient regarding the management of the disease. Measurement of capillary blood glucose has become simple with the recently introduced glucometer. As glucometer is introduced recently, it helps the easy and early detection of the glucose. Glucometer manufacturers made them very simple and user friendly, and even patients can measure the CBG without any difficulty. Individuals who could Benefit from the screening of blood sugar include patients who are experiencing anxiety about the development of diabetes mellitus can check it. Patients' hyperglycemia was controlled by either diet alone or by oral hypoglycemic drug in early direction. Individuals who are diabetic and require regular blood glucose monitoring for evaluating the drug therapy. Individuals showing symptoms of diabetes such as polyuria, polyphysia, tiredness, and weight loss can check the blood glucose level. Blood glucose screening should not be performed by pharmacists who are under the 18 years of age. Persons with visible evidence of infections in their finger and nails, immunocompromised drugs taking patients are not should not take them. This test. How to use glucometer means we have to use a clean alcohol cotton swab to clean the fingertip, next prick it and place a drop of blood in the strip which is given in the glucometer. Next, the strip, the blood will react with the reagents present in the strip. Next, it will give the glucose count. Normal will be there will be three testing. One is fasting. Next, postprandial. Next, random. Normal, it must be less than 80, and random will be less than 99. If the patient having diabetic means fasting diabetic 99 to 138. Cases there will be they need further clinical referral. Non-type random, for random 138 to 50 need further doctor consideration. Diabetic one more than 180 needs immediate medical attention. Individuals who will get benefit from the screening of blood glucose include patients who are experiencing anxiety about the development of the diabetes mellitus, whose diabetes was controlled by diet alone or by oral hypoglycemic drugs. Individuals who are diabetic and require regular blood glucose monitoring for evaluating the drug therapy. Individuals showing symptoms of diabetes such as polyuria, polypepsia, tiredness, weight loss. Appropriate measurement of the capillary blood glucose is useful to detect the fresh cases of the diabetes mellitus. Capillary blood glucose can be measured by using glucometer, which is a small electronic device following the normal values. First is CBG 70 to 100 mg per dl, postprandial 110 to 150. Next, random 100 to 150. What are the next one is body mass index, statistical measure of body fat based on height and weight that applies to both adult men and women. AMI is the most widely used diagnostic tool to identify weight problems, whether individuals are underweight, overweight, or obese. BMI less than 18.5 means underweight. 18.5 to 24.9 is normal. 25 to 29.9 overweight. 30 to 34.9 obesity class 1. 35 to 39.9 obesity class 2. Greater than 40 means extreme obesity. BMI is calculated by weight divided by height whole square. Next, we can also check the cholesterol. Cholesterol is checked by using the blood glucose, blood. For this, um, cholesterol testing, also known as lipid profile testing, measures the level of the cholesterol and triglycerides in the blood. Cholesterol is a fatty substance found in the blood, and it's essential for the body's normal functioning. However, high levels of cholesterol can increase the risk of heart disease and stroke. Important heart health assessment. Cholesterol testing helps assess an individual's risk of developing heart disease and other cardiovascular condition. Preventing healthcare by identifying high cholesterol levels early. Healthcare providers can implement preventive measures to reduce the risk of heart disease. Treatment monitoring for individuals already diagnosed with high cholesterol. Regular testing helps monitor the effectiveness of the cholesterol, lowering medications and lifestyle modification. Risk factor identification. Elevated cholesterol levels can be a warning sign of other underlying health condition such as diabetes, hypothyroidism, or liver disease. Methods of cholesterol testing. Test a blood sample is usually obtained by pricking the patient's finger or drawing blood from the vein in the arm. The sample is then analyzed to measure the level of total cholesterol, low density lipoprotein, very low density lipoprotein, high density lipoprotein. Non-fasting lipid profile. In some cases, non-fasting lipid profiles may be performed, which means the patient does not need to fast before the test. This option provides more convenience for patients and can still provide valuable information about cholesterol levels. Point of care testing. Some pharmacies offer point of care cholesterol testing where a small blood sample is analyzed on site using a portable device. This is available within minutes, allowing for immediate interpretation and counseling. Interpretations of receptors and cholesterol will be uh, less than 200, LDL cholesterol less than 130, HDL cholesterol less than 60, triglycerides HDL cholesterol greater than 60, triglycerides less than 150. Dangerous means 240 and higher total cholesterol, LDL 160 and higher, HDL under 40 and in male and under 50 in female. At risk 200 to 239 total cholesterol, LDL 100 to 159, HDL 40 to 59 in male, 50 to 59 in female. Heart healthy total cholesterol under 200, LDL under 100, HDL 60 and higher. Counseling and follow-up. Based on the test results, healthcare providers, including pharmacists, can offer counseling and recommendations to patients, including lifestyle modifications, some diet, exercise, and smoke cessation. Refer to the physician for the further evaluations or treatment. Education on the importance of cholesterol management and cardiovascular health. Conclusion. Cholesterol is a valuable tool in assessing cardiovascular risk and promoting preventive health care. By identifying individuals with elevated cholesterol levels, healthcare providers can implement interventions to reduce the risk of heart disease and improve the overall health outcomes. Offering cholesterol testing as part of health screening services in community pharmacies enhance accessibility to preventive care and contributes to public health initiatives aimed at reducing the burden of health cardiovascular diseases. In this video, what are the condition we have seen, means what are the health screening services, what are the benefits of health screening services. Then in that we have seen the about BP checking, sphygmomanometer and glucose checking, glucometer, BMI, cholesterol checking, and their major role in playing the importance in playing the promoting the health of the patients. Thank you.